This conference will now be recorded.
So, okay. So thank you all for joining us today for our conversation with the experts on scleroderma and COVID-19. We're thrilled that you can be with us today for this session. My name is Brett Thombs, along with Linda Quackenbos from Radboud University in the Netherlands. I direct the Scleroderma Patient-Centered Intervention Network, or SPIN. SPIN's mission is to work with people with scleroderma to identify their needs and prioritize research in areas most important to them, and to develop, test, and disseminate accessible patient programs to improve the quality of life and empower people with scleroderma and their loved ones. Times like this, having access to trustworthy evidence and advice is crucial. So, keeping with our mission, we're fortunate to bring together just an outstanding group of experts today in scleroderma and in infectious diseases, including COVID-19. I want to thank all of our panelists for the generosity in the midst of everything else they're doing right now to care for our communities, to take time to share with us today. We also want to thank our wonderful friends and organizational partners for sponsoring today's event with us, including Scleroderma Canada, Scleroderma Society of Ontario, the Scleroderma Foundation, and the Scleroderma Research Foundation. Finally, excuse me, a tremendous thanks to our SPIN team, particularly Lydia Tao, Angelica Bergeau, and Maria Carrier, who got information out and put all this together in barely a moment's notice. So great job. Thanks to all of you. Before I introduce our panelists, I want to go over some basic instructions for how we'll run the panel today. First of all, please turn off your webcams. There's a button again at the bottom of your screen. There are too many participants for everybody to share their webcam, so it'll create a better experience for everybody if we all have our webcams off if you're not on the panel. Again, at the bottom of the screen, you can click that off. Similarly, the audio button at the top of your control panel allows you to turn off and mute your audio status. Finally, and this is also important, the control panel includes a chat pane where you can send questions that you would like the panelists to answer. Use the drop-down menu and select organizer only, ideally. If you're not able to figure that out, it's okay. You can post your questions because everybody will see them. And I'll do my best as a moderator to get as many questions as possible to our panelists. If you'd like us, if you're comfortable, please include your name, where you're from, and I'll include that with your question. Thanks to everybody who submitted questions via the internet this week. We'll go through as many of these questions as possible, and we'll also take questions during the panel as I noted. Now, it's my pleasure to turn things over to our panel to introduce themselves and make a brief statement to start. I'd like to start with Maureen Sauvé, a good longtime friend, past president of the Scleroderma Canada and the Scleroderma Society of Ontario. Maureen? Okay, panelists, please click on your mics when you speak. Maureen, you're still muted there. Sorry about that.
My apologies. Thanks, everyone. I understand how challenging it is for us as patients through these times. People throughout the world are anxious about COVID-19. But for those of us who are part of the unfortunate group or a subgroup of chronically ill, that anxiety is particularly heightened. What does higher risk mean? For me and for the rest of the community, scleroderma community, we have many questions and concerns, as do our family and friends. Should we be taking immunosuppressant drugs or should we stop? When you say higher risk, what does that mean? Does it mean that I'm more likely to get sick? These are among the questions that many of us have been asking ourselves. And to our doctors who have, highly esteemed doctors who have joined us today, with a pandemic in our midst, I recognize that your scarcest resources are time and energy, and we are so grateful to you for sharing those with us today. I will say nothing more and wait anxiously for our doctors to begin their conversation. Thank you.
Great, thank you, Maureen. Next, I'd like to introduce Dr. Don Sheppard. Don is a chair of immunology and microbiology at McGill University and an active clinician who's right in the middle of all this right now. So thanks, Don, for joining us. I know you're going from 24 hours a day right now.
Yeah, it's been a very busy time for everyone, actually, and a very unusual time. We're definitely in uncharted waters, both in the healthcare system and for everybody in society. Do you want me to go through the introduction now, Brett, or just do an? Yeah, okay. So I'm tasked with talking to you about the virus itself, because this is what I do for a living. I deal with infectious diseases, people who are infected, managing outbreaks, and exactly the sort of virus end of things. And I'm not a Scleroderma expert, and you have many people on this call who will be talking to you specifically about Scleroderma, and my end is really the virus. So what I want to do is start with just a basic overview of the course of disease that happens when people are exposed to coronavirus, because there's a lot of very important concepts, if we understand the basics, that can actually answer some of the questions that many people have, in particular with respect to testing and protecting yourself. So let's start at the point where you are walking down the street and some unfortunate person who has COVID-19 coughs directly on you and the virus lands in you. So we know that this is spread by respiratory routes, particularly droplets from people that cough, sneeze, as well as short-term contamination of surfaces. So you now have the virus in your body, and we need to know what's going to happen to you. So the first thing that happens to you is absolutely nothing. The virus starts to slowly reproduce in your body, and in this first phase, you're completely well, you don't feel sick, you don't look sick, and you're not shedding virus. So even though you've been exposed, even though you are predestined to develop disease, if I was to do a test for coronavirus on you, if I was to swab your nose and look for the RNA of the coronavirus, which is how we do this, your test will be negative. There's no way to distinguish you from everybody else in the population. So this tells you, of course, that getting tested after an exposure is not a very useful thing to do, particularly in the early times. So then we move into phase 2. So phase 2, the virus is reproducing in your body. You still feel good, you have no symptoms, but now the virus has made enough of itself that it's spilling out and you're shedding virus. And we believe that unlike other viruses like SARS, there is this period where you are asymptomatic, but you are shedding virus and therefore can transmit it. And this is really important for you to understand, because it means that people out there on the street who look completely well can be shedding virus if they're in this phase 2 of the disease. Testing here again, not always helpful, because only a percentage of these patients, and we don't know what that percentage is, will have a positive coronavirus test. And many will have a negative test, even though we believe they are infectious. Then we, of course, move into phase 3. Now you feel sick. You have symptoms, and they can be anything from just a slight sore throat, a little headache, a little fever, a sniffles, a cough, to full-blown, very sick, coughing, can't breathe, high fevers. You're shedding a lot of virus. You're quite infectious, and usually at this point, your test is positive. Although not always, we do still have false negatives with the testing. And obviously, at this point, you should be isolating yourself because you know there's something wrong with you. And as we'll talk about, there are times when you should not get tested and go to the hospital and get yourself dealt with. What happens after that, we also don't really know yet. We don't know how long this last phase will last. So we know that the beginning part, from when you're exposed to when you develop symptoms, is on average 5 days, and it can go as long as 12 days. So that's why when you have an exposure, if you've traveled, if you're in contact with someone that's a known case, we ask you to self-isolate for 14 days, because that gives us a safe buffer around this 12-day window. That's where that number comes from. Now, if you have a case of coronavirus, if you're actually sick, we also ask you to stay isolated for a minimum of 14 days, but we don't know how long you can still be infectious afterwards. And there's studies that are ongoing to look at that. Some of them suggest it can be as much as 3 to 4 weeks, but probably the majority of patients are no longer infectious by 2 weeks. So that's the basics of when you get the virus, when you are infectious, when you get symptoms. And I think it highlights the fact that there is what we believe pre-symptomatic shedding of the virus and pre-symptomatic transmission. In fact, we estimate that 60% of the cases of coronavirus that are out there right now got the disease from someone that had no obvious symptoms. And so this is really important when you consider how to be protecting yourselves going forward. And then the next piece to talk about here is testing. So I've given you a bit of background on this. Obviously, you understand now from what I have said, hopefully, that you can't get tested immediately after an exposure. You can't really get tested when you're asymptomatic and have the test tell you that you're going to be safe. If a test is positive, it's positive. We know you have coronavirus. But a negative test doesn't tell us you're not going to develop coronavirus tomorrow. So don't go get tested, don't ask to get tested, don't look to get tested if you have an exposure or think you had an exposure. That's a waste of resources in the system. It's a waste of your time, and frankly, it may put you at danger, because when you go to the place where people are getting tested for coronavirus, guess who's there? A bunch of people with coronavirus. So you don't want to go there unless you really need to go there. So when do you get tested? We are actually, because the test kits are still a little bit in shortage around the world, we're not telling every single person with the sniffles to go get tested for coronavirus. We want people to get tested when we think there's something we can do about it, at least until we have so many test kits that we can afford to test everybody in all of the populations around the world. But right now, you should get tested if there's something that can be done about it. And as you'll hear from my rheumatologist colleagues, that is relevant to people with scleroderma, particularly if they're on immunosuppressive medications, or if they already have lung disease, because in those two situations, it is important to know you have coronavirus. There will be decisions that might have to be made with immunosuppressive medicines if your rheumatologist knows you have a viral infection, not if they're at risk or suspect, but when you actually have one, that's a time to ask those questions with your caregiver. The other time that, of course, it's important is if we know your lungs are already fragile and you are starting an infection, then we want to know early on that you're at risk for something that's going to develop down the road. So that's just a big overview to cover some of the very simple basics about the coronavirus and how it may interact with those of you that have scleroderma. And I'm going to pause here, and of course, we'll come back to questions later on.
Thanks, Don. That's great. And of course, yes, we will have many questions for you going forward. It's my pleasure now to introduce Dr. Janet Pope from Western University in London, Ontario. Many of you already know Janet for expertise and her guidance to scleroderma patients around the world. So Janet, we'll let you introduce yourself and go forward.
Hello, everyone, and thanks for attending. We have like a record number on a Saturday morning, so you know things are really pretty serious. I'm at Western, so London, Ontario. I run a big scleroderma clinic and see lots of other immune-suppressed patients. I think before we get into questions, my couple words of wisdom are there's a lot of stuff on the internet and it changes every day. So what was good yesterday is bad today and maybe good again tomorrow. And as a, for instance, ibuprofen in a small study might have made coronavirus infection worse for those who were quite sick. Then Health Canada has said, no, that's not true. Hydroxychloroquine, for those of you on it, might be good to help coronavirus. It does help malaria, so it helps other things. But again, we don't know about that. And immune suppression is a real risk. However, most of our patients, you can tell how immune suppressed you are by how many significant infections you had, say, last year or the last few years. So we know that having interstitial lung disease and or having your scleroderma without lung disease puts you at a slightly higher risk than the general population. But we do know that most people, the risk would be about what it is for when you get frequent infections or you don't. So I think that's something to just hold on to as we get to other questions.
Great. Janet, can you speak a little bit about what kind of people should be engaging right now to keep themselves safe before we turn it over to Varga?
Yes,
what should people be doing? Should they be out in the community maintaining 2 meters? Should they be staying at home? Can you talk a little bit about that, please?
Right. So first of all, it's very different to know, and we have Americans and Canadians on this call. So it also depends on the province or state you're in right now, because Canada is a little bit behind the US in this whole pandemic and the inflection curve going upwards. So number one, stay at home and socially isolate wherever possible, which means when you go out to get your essentials, you come back and you wash your hands well. You don't touch your face or your eyes. Number two, if you are an essential worker, you go into work. Number three, if you're at risk or you feel that your immune system is overwhelmed because you've had lots of serious infections the last few years, then you might be able to work at home. I think you have to look at what your public health says, your state or provincial matters, what they say, and what your employer or supervisor says. But right now, essential services really do need to work. And if you're social distancing at work, you're at less risk. You're not going to gather around the coffee maker anymore if you're at work. But wherever possible, working from home is great, but that's not feasible for everyone.
And I do want to point out, and maybe Dr. Varga can comment on this too, that the Scleroderma Foundation, I'll point this out now, I should have brought this up earlier, has the Medical and Scientific Advisory Board Leadership Committee of the Scleroderma Foundation has made recommendations on COVID-19. It's a wonderful document. It's posted on the Scleroderma Foundation website. And they actually do also point out, in addition to what Dr. Pope has said, that if you are on immunosuppressant treatments or have lung disease, they're encouraging you to self-isolate at home for now, going forward. Dr. Varga, we'll turn it over to you. Dr. Varga is a rheumatologist from Northwestern University in Chicago in the United States. He was one of the members of the leadership committee that put together the recommendations for the Scleroderma Foundation. And can discuss some of those a little bit and also talk about treatments. What should you do with your treatments right now? Should you change anything now that we're in the middle of all of this? Thanks, Dr. Varga.
Good morning, everyone. It's a pleasure to be here. I am the director of the Scleroderma program at Northwestern. I definitely want to reiterate what some of my colleagues have commented. Patients with scleroderma are potentially at higher risk from this pandemic because of three reasons. Autoimmunity, or an altered immune system. Many patients with scleroderma have lung disease and variable levels of lung injury already. And many of these patients are taking immunomodulatory or immunosuppressive drugs. It seems that having an autoimmune disease in the type of scleroderma is not necessarily a major risk factor for either having an increased risk of infection or having a worse outcome. So that's the good news. There's no strong evidence yet that having an autoimmune disease like scleroderma is a major risk factor. On the other hand, having lung disease, particularly significant lung disease, is of concern, and the data, particularly from China, seems to support that, although it's also possible that smoking rates and emphysema are much higher in China, and that may be a contributing factor. But nevertheless, it's very clear that if you have significant lung injury, you're at higher risk for having greater lung complications. The third issue, of course, is that patients with scleroderma are often on immunomodulatory drugs. And so the question is, drugs like Celsep, rituximab, methotrexate, Plaquenil, what to do about these drugs. At the moment, we really have not a lot of hard information. And in general, I think the safest recommendation is that before you discontinue any medication, you should have a conversation with your scleroderma provider. In some cases, an immunomodulatory drug might be safely discontinued, particularly if your disease is not particularly active or progressive. But in other cases, it's quite important to stay on these drugs, and the risks and the benefit ratio has to be carefully weighed with your physician. As Dr. Pope also mentioned, there's a tremendous amount of misinformation out there, of course, at this time. And medications like Plaquenil, that I'm sure there'll be many questions on, some of the data to support that it might have a beneficial effect is actually very weak, and there are concerns about its non-indicated widespread use that could be more harmful than beneficial potentially. Similarly, there are concerns about non-steroidal anti-inflammatories such as ibuprofen and similar drugs. And again, we're not aware of any really hard information that would support that these drugs make the disease worse. So I think the bottom line is that, generally speaking, you should try to stay on your current medication and always discuss with your scleroderma doctor any decision to reduce the dose or discontinue, and when to do that?
Great, thank you, Dr. Varga. So we have a lot of questions both during the week and now. Yeah, go ahead, Don, please. Don?
Brett, can I just emphasize one point that John made that I think is really important for people to understand? So right now in Italy, which is perhaps the most hard-hit country currently in the world, the rate of coronavirus in the population is far less than 1%. In fact, it's probably a rate of 1 in 1,000 in the population in the worst hit country. Now, I don't say that to mean that you are safe and you shouldn't worry about wandering around the streets and you can do and go about your regular life. Far from it. But I want people to think about that number when they think about whether they're just going to stop their therapies for scleroderma based on some possible risk that we don't really understand. Your risk of having a complication or something go wrong with your therapy if you just out of the blue change your medication today, compared to that 1 in 1,000 risk of getting the disease when we don't even know if there is a higher risk down the road, really argues strongly that don't go and start changing your medications out of the blue here. This is something you need to do carefully and in consultation with your care provider.
Thanks, Don. We have lots of questions about mobility and isolation, and maybe I can bring that back up again, and how to keep ourselves safe, or if you have scleroderma, how to keep yourself safe. And as I noted, the Scleroderma Foundation is recommending that if you are, have lung disease or on any immunosuppressant, that you do want to. They're using the word self-isolate. We have lots of questions what that means. Does that mean someone should stay in their room by themselves, stay in their house with their family? Can they travel safely? Could they go out for a walk if they're isolating like that? Either Don, do you want to take that, or one of the others maybe? What would you recommend for someone who's following the Scleroderma Foundation self-isolation because they are an at-risk patient?
So there's no perfect solution here, right? There's no formula for every single person that's going to be the right way that they live their lives, because obviously we all have different family situations, we all live in different environments, and we all have different activities that we need to do on a daily basis. The advice that we're giving is similar to the advice that we're giving to people over the age of 65 and in particular over 70, which is you are really just trying to limit your social contacts to the absolute minimum that you can keep your life going. And so that means that, yes, you can go outside the house and go for a walk around the block, but as happens on my street right now, when people see you coming, they cross to the other side of the street, or they walk out into the road to be 6 feet or 2 meters away from somebody. And if you are 2 meters or 6 feet away from somebody passing them on a street, you are pretty safe and you are not going to get coronavirus for them unless they deliberately try and cough at you and chase you down the road. So don't feel like you have to be a complete shut-in. You can go outside, you can get some fresh air. We all need vitamin D, and that comes from the sun. So do that. Do your shopping if you have to. If there's someone that can go out and get your groceries for you who is not at high risk, then don't do it. You take advantage of your social network and your circle to get that kind of support. If you order things that are being delivered to your home, you don't need to shake hands with the delivery person. You can wave at them and ask them to put it down. And by now, most delivery people around the world are quite happy to drop things on your doorstep and run rather than meet 500 new people every day like they're doing. Now's not the time to get your hair cut. You can wait for 2 to 4 weeks to get your hair cut. You can live with gray roots if you're like me. You can live with any of these things that are minor nuisances and wait until we know where the numbers are going in your local area. And track your local data, because you're not going to get coronavirus from someone in a neighboring country. You're going to get it from your neighbor or your social contact. And so that's going to be very important. If you are at risk and you live with people, that's a whole different thing to consider. We don't usually tell people that if there is a person who's isolating themselves, that everybody in their house has to isolate themselves. Now, that's not because there isn't a risk, but that's because if we start doing that, all of society is going to collapse because everybody's isolating all the time and we can't maintain essential services. So reality has to come in here to play. But what you can do is if you have a household members that are in routine contact with the public and that are out there, you should try and isolate from them as best you can. That means try and avoid extra physical contact, try and keep a 2-meter, 6-foot distance between you and those people. If it's your spouse, this is just what you're going to have to accept as a risk in life, because I don't think that with the amount of transmission we have here, anybody should be socially isolating themselves to the point where they don't have the necessary psychological comfort of having those people that are absolutely critical to their mental health with them. And I don't recommend that husbands and wives should be sleeping in different beds if they don't already, unless one of them actually has disease or is known to have disease. So somewhere between that line and, oh, don't do your daily life is what we're recommending. Lots of soap and water, lots of washing down of surfaces, and of course, anybody who's sick is on really strict isolation. And at that point, you do sleep in different rooms. You don't go within 6 to 10 feet or 2 to 3 meters of each other, and you go ahead and figure out what's going on over time. Does that help?
Wonderful. Thanks, Don. That's great. Well, I'm going to ask Dr. Pope. I have some questions here that are important. You know, many people have different levels of lung involvement in scleroderma. When would someone think they should be at risk because of that and maybe take more stringent isolation versus maybe less at risk? Can you speak to that for the group?
Right. So the first answer is we don't know. The second answer is sometimes your immune suppressant might actually help you not get the big body reaction when your COVID virus becomes really quite severe. There's a big chemical reaction of inflammation markers. So your treatment might actually be helpful, but it might not be. We don't know. So for the level of lung disease, what we do know from studies to date that the main risk factors for people getting sick with COVID or coronavirus are number 1, advanced age, number 2, obstructive lung disease, number 3, diabetes, and then things like immune suppression and interstitial lung disease, we really don't know too much about. So what I would say is that if you're on oxygen or significant dyspnea for whether it's interstitial lung disease, pulmonary hypertension, one, the other, or both, or significant heart failure, please self-isolate, do all the things that have been said. If, however, you have mild interstitial lung disease and might need treatment, but you're not short of breath, or it might not even need treatment, it's being followed, then you might or might not be similar at risk to the general population. And I think the two risks that we think about are, is someone with scleroderma at higher risk of getting the virus? And then if they get the virus, are they at higher risk of having the serious complications? Because as you've heard already, many people will just have an annoying cold. That's what COVID will be to them. But if you get sicker and go into those further stages, that's obviously the people seeking medical attention, the people who are being tested, and some of the people who end up in the ICU, heaven forbid. So I think mild interstitial lung disease probably gives you a risk that's similar to other patients on medications like yours and not an increased risk, but I don't know. What I would say is serious lung disease, serious heart disease from scleroderma or hardening of the arteries, serious breathing problems. These people are probably at higher risk, but age seems to be a really high risk. So age over who knows what, but elderly, whether that's 80, 70, 75, and your past risk of infections is probably important. If you get lots of viral infections, you might be at higher risk of getting this too, but you might not be. So lots of uncertainty. Sorry about that, but it's true.
Thanks, Janet. Keeping on the theme of keeping ourselves safe right now, before we move on to some other questions, I have a very, very practical question from Amy Geitzen in Buffalo, New York. Amy says, how can you get a substantial hand wash when you have ulcerated sores on your fingers? Are there alternative ways to hand wash? And I don't know if John and Dr. Varga, you want to know anything about what people with ulcers do for things like that, or Don, you have suggestions for that, given what you've done in keeping ourselves safe with infectious diseases. Do one of you want to try to address it? What can someone do with ulcerated fingers to wash their hands?
Well, I think it's obviously a concern, but because you are doing a sterile procedure, the risk of getting the ulcers further infected is very small. So I would proceed with rigorous hand washing as much as possible, even if you do have ulcers, because you're doing it in a sterile situation. So the ulcers are not going to get further infected from that.
Yeah, I mean, obviously, the key thing is that the virus isn't going to infect your ulcers, so you don't really have to worry about that per se. It's really just a matter of trying to avoid worsening your ulcerations with frequent hand washing, and clearly avoiding alcohol and all of these other chemical wipes is a key thing to do, because those are not going to do good things to ulcerated skin.
And I would just add to that, your usual hand cleaning routine. So although there's shortages, a lot of people within a hospital or a clinical setting will be using alcohol-based or non-alcohol-based dry washing, or washing with soap and water. So I think look at the areas that you can clean, keep the rest maybe covered or protected when you go do your groceries, and use whatever your usual cleaning routine is, being cognizant that we don't want an active ulcer feeling like it's burnt every time there's a solution on it.
Great, thanks, Dr. Pope. We have a question from Glendon, Waterford, Michigan, who's asking if we know of any specific cases of COVID-19 and scleroderma and what they've been like. I think the answer is we don't know of any of those, but someone can correct me if that's not the case. Do we agree we don't know of any cases in scleroderma at this point?
There are patients, hospitalized with suspected COVID or just interstitial lung disease, but I'm not aware as yet of anyone having an unusual course or a more severe course, fortunately, as far as I'm aware.
Yeah, just to make it clear, and John already mentioned this, but maybe to re-emphasize it, what we're giving you as guidance in terms of the immunosuppression and in terms of autoimmune disease and the increased risk of those two risk factors is based on our general understanding of many, many other viruses where we have more data, where we have more experience, and we know that patients who are receiving immunosuppressive medications are at increased risk for longer and more severe diseases. But there's actually no data yet in the COVID outbreak suggesting that that is the case for coronavirus. It still may be, but we don't actually have any studies that are telling us that, oh, we need to be very careful because this drug or this autoimmune disease or that autoimmune disease are linked to worse outcomes. That's not the case for lung disease. As we mentioned before, lung disease is very clearly a risk factor for more severe outcomes in this viral infection. So that is where we can be very confident that people who know they have lung disease should be extremely careful. But when it comes to the immunosuppressive medications, scleroderma and other related diseases, we are just using our general knowledge that we have from other viral infections. And when we actually look at the data that was reported from China, which was, I believe, I can't even remember how many, I think 45,000 patients that actually looked for diseases that were associated with a worst outcome. They found diabetes, heart disease, lung disease, cancer, but they did not actually find autoimmune disease or immunosuppressants as one of the things that was linked to worse outcomes. Now, they didn't go looking specifically and collect all their patients with scleroderma or arthritis, so I think we wouldn't want to say that the jury is back in on that yet, but it's a very encouraging sign that this is not going to be something catastrophic for people that have those conditions.
Great, thanks, Don. Don, we have a couple of questions from Michaela Linkova from the Czech Republic, who's asking about things that people might do at home to prevent infections. Does it make sense to increase your intake of vitamin C, to do other things, zinc, omega-3, or to try to prevent infections? Would you recommend any of those things?
So the fact of the matter is that all of the supplements and vitamins that have been looked at that have benefits that people think of as improving immunity have not been shown to actually have any benefit whatsoever with viral infections in general. So there's really very little evidence that taking any of those supplements, and I'm being very broad with this because we haven't found any yet, that actually really improve outcomes in respiratory viral infections. Again, COVID itself, we've not looked, the data isn't there, we simply don't know. But if we extrapolate or we extend our knowledge from all of the other respiratory viruses, from influenza to the common cold, none of those things that people think of as improving their immune system are actually of benefit when people look at them in a very hard and clear way. That said, there are clearly the basics that you can do, like taking care of yourself, eating a balanced diet, making sure that you're getting vegetables, making sure that you're getting exposure to sunlight so your vitamin D levels aren't low, making sure that you get exercise, a good night's sleep. All of the basic things that we do to keep ourselves healthy are, if anything, more important than they are. The worst thing you can do is turn into a Netflix watching, couch potato eating potato chips 24 hours a day during this particular outbreak, because even if that doesn't hurt you from a coronavirus point of view, it's not going to put you in good shape for when the virus has left us.
Great, thanks, Don. John, I see lots of conversation. This is going to vary across jurisdictions. Of course, I see people here from all over the world right now on the call, Europe, the States, Canada. What should people do about the routine doctor's appointments? I think in some places, hopefully the medical system would tell people what to do, but people are asking, you know, should I go to my routine checkups or my routine rheumatology appointments? What are you doing with that? What would you suggest, John?
Very much dependent on where you are. You know, as you mentioned, in the States, unfortunately, we are ahead of you. New York is very badly hit, and Chicago, where I am, we went on a stay-at-home hunkering down mode this afternoon, where basically only essential people and essential activities are allowed. So in light of that, what we've done is essentially gradually convert all of our clinics to telemedicine, where we have regular patient appointments, but we do them over phone or video. And it's actually gone rather well, where we can address patients' concerns, questions, worries, and give information. Of course, we cannot make the kind of in-depth decisions as we normally would during a patient visit, but it's generally been felt that, you know, patients, particularly high-risk patients like those with scleroderma, are probably better off not coming to a hospital, whereas, as Dr. Sheppard said, you might actually be exposed to patients who are more likely to be actively shedding the virus. Now, of course, there are situations where there really needs to be intervention, but I think it's very important that you contact your provider, your scleroderma doctor, or your primary care doctor, and make a decision of how to address the issue. If you must come into a scleroderma clinic, most places will be able to make arrangements for that. If you must go to an emergency room, that's also, of course, an option, but it's very important that it be pre-checked to make sure that if you're going to a hospital or a testing center or an emergency room, they are aware if you have symptoms, possibly of COVID infection, and that they are aware that you have a significant risk factor like underlying significant lung disease. So that's how we've been handling it, and it's so far in the last week, it's generally worked reasonably well.
Great, thanks, Dr. Varga. Something that's come up a few times in your comments, including Dr. Sheppard's comments, is kind of the importance of balancing, you know, keeping yourself, reducing your risk of getting infection, and taking care of your overall health and well-being. And I think this is important. And the World Health Organization and some others have made some recommendations on mental health, and these are really crucial. I mean, if you isolate yourself and aren't speaking, we're social creatures. You're not going to do yourself well if you're in a room by yourself every day, 24 hours all week. So, you know, it's really important. And actually, if you follow us, Spin on social media, thanks to Angelica Bergeau, who put out yesterday some an infographic on ways you can keep connected, ways you can get groups of people together online that can speak with if you have groups like that. It's really, excuse me, really useful information. We have something else coming out Monday, I believe, on mental health, but one of the really important things are like that. Stay connected, and you might even want to schedule that. You know, make sure there's certain times of the day you're touching base with people that you usually touch base with. This has come up a few times. Move your body. As Don said, if you're on the couch eating potato chips all day, you're not going to do well. You're going to feel badly both in your head and everywhere else. You'll do terrible. So, you know, get out. don't hug everybody you see once you're out there, but go for a walk, go for a hike, do whatever you can normally do. I mean, many of you go out and do these things anyway, so find a way to do what you can. Eat healthy meals as ideally you would anyway. Monitor what you read. It's really easy right now. I mean, I remember back in 9/11, the same kind of thing. We had a crisis. We'd sit there in front of the TV and get every drip of news that might come through to see what's going to happen next. Monitor that. That's not helpful for our sites to be flooded with how badly this might be going. Excuse me. So go online, get the information you need, understand what's happening around you, and then disconnect and read a book, watch a movie, connect with friends and family, and try to maintain some kind of routine as you're at home. Get up, do the things you normally would, get your shower, eat your meals, and so forth, and keep that. If you do have a mental health condition, make sure you get your prescriptions filled. If you do need to see somebody about that, touch base with your mental health care provider. I think some of them are quite able to do touch base by telehealth right now, by phone or otherwise, and see if they can do that if you do feel that you need support. So going back now on prevention, something that's coming up quite a bit. We have many comments on hydrochloroquine. So Tracy from East Rochester, New York, Nancy from Park Rapids, Minnesota. I'm going to leave names off because we have many questions on this. Carol from Northern California, Rose from Pearland, Texas, are asking a couple of things. Don, maybe you want to address this. Is this likely to be a prophylactic? What do we know about this in preventing infection for taking these medications? And what about people who are already taking them with scleroderma? Is this going to reduce their risk of infection?
Thanks, Brett. So there's been a lot of discussion about chloroquine, Plaquenil, hydrochloroquine, and those drugs, as well as, for those of you that are following the literature, azithromycin as well, that has been implicated in potentially preventing spread. I think we need to understand what data we have. What data we have is incredibly limited. We're talking about a case series of about 20 patients where people looked at these drugs in treatment. And this wasn't what we call a randomized study. They didn't take half the people and give them the drug and the other half and not give them the drug and compare the outcome. They just threw it at a bunch of people and said, they did okay. Maybe this is a good thing. And that's actually the level that we're at right now with our knowledge. That said, any positive signal is enough to get people excited, because when you have nothing, anything looks good. And so there are a lot of trials that are running right now, large-scale trials to test for these anti-malarial medications and antibiotics, and a few others, including some HIV drugs that people are testing to see if they can be useful. And we're testing them in two different ways. One is to see if they're useful in severe disease and can they improve outcomes in people who are sick. And number two is looking at contacts. And in particular, we're looking, a lot of these trials are focused on healthcare workers, because obviously losing healthcare workers right now is the worst possible thing that can happen in the system. And so we're looking at giving them to healthcare workers that have contacts with coronavirus cases. But it is very, very early days. It is absolutely too early to suggest that anybody should be taking them. As the patients who are taking them now know, they do not come with no side effects. And if we start giving them to thousands and thousands of people across the country, we risk having side effects in people for absolutely no benefit. And also we risk crashing the supply of these drugs and keeping them away from people who need them the most. Right now, there's been a lot of concern about shortages. There are only shortages that we have found at individual pharmacies, obviously, if they run out, but the main stocks are still okay. But the shortages are actually that you're hearing about are when people want to run very large trials with these drugs. So if you want to test 5,000 healthcare workers and give them 5,000 of them drugs for a week, you obviously need an awful lot of this stuff. And so we've been in contact in our institution and others with actually the manufacturers. They are trying to ramp up production, and it's optimistically anticipated that even if these trials look positive, that we're not going to completely crash the world supply. There may be some shortages in the near future. So if you are on these medications and you have 4 pills left in your cupboard, really good time to get them refilled, because there may be a short-term challenge in getting them, but I don't think we'll get to the point where they are absolutely not available.
Yeah, John, please.
Yeah, I'd like to second what Dr. Sheppard said. There's been a run really on this very old medication, particularly because it's generally viewed to be very safe and inexpensive, which is true. I think for people with scleroderma, if you're on Plaquenil, which many patients are, Cellcept, hydroxychloroquine, you should stay on it. But there's no evidence to date that any of us are aware of that it actually prevents infection. Now, having said that, there are interesting basic science studies suggesting that once a virus is established, you might slow down its growth in the body by using Plaquenil. So as Dr. Sheppard said, there are several clinical trials currently ongoing to see if patients who already have tested positive and are ill with COVID, whether giving them high doses of Plaquenil in the hospital can improve outcomes or slow the progression of disease. But that's very, very different than taking it if you're not ill or even if you're having symptoms, but taking it in a prophylactic way, which really is not justified by anything that we know today.
Thanks, John. Janet, we have some questions on pregnancy. If there's any precautions that people with scleroderma who are pregnant should be taking right now, could you address that?
Hi, everyone. We're also doing an awful lot of chat questions, so that might be helpful for people to read. And I've been tweeting this, so there you go. So for pregnancy, I think it's important to note that the bad outcomes in young people, so babies, pregnant moms, early postpartum for the mom or and the baby, have been in general these groups of people are very, very low risk. If they get an infection, they seem to more have just a regular common cold than anything else. So age is that big risk, and obviously if you're pregnant, you need to go to your appointments. What has happened right now in Canada is that the Canadian College of Family Physicians has said some appointments at certain times should be with the physician, whether it's your OB, your nurse practitioner, your family doctor, and other ones can be done by a teleconference. If you're having problems, high blood pressure in pregnancy, complications, baby not growing right, you really do need to keep your appointments. What the OBs have told me in our area are that they are booking people far less often. They're having big holes in the waiting room so everyone can social distance, so less people in the waiting room. They're trying to get them in and out as fast as possible. And they're trying to avoid unnecessary visits. So all those things are important. But again, there's already worries if you have an autoimmune disease like scleroderma and you're pregnant or you're exposed to someone who's pregnant. So you already have all those worries. But I think you can rest assured that in other countries at this point in time, many healthy moms, healthy babies, healthy postpartum baby and moms this has occurred. So ask your doctor about what visits are necessary, but please don't avoid your visits if you need them.
Great, thanks, Janet. We have a couple of questions here on posed to Dr. Varga about corticosteroids. They want to come up. The question is, should they be avoided unless absolutely necessary? What if we're already on them?
Yeah, so corticosteroids is problematic at high doses because it does make you more immunocompromised. So the possibility of getting the virus perhaps goes up, and certainly less ability to resist the virus is a potential. Fortunately, I think most people with scleroderma take rather low doses of corticosteroids, and the doses that are commonly used, which are typically on the order of 20 milligram or less of prednisone, are probably reasonably safe at this point. But again, I think it's very important that you discuss it with your physician as to why specifically you are taking it and whether in your case it's appropriate to stay on it or reduce the dose. Definitely don't stop steroids cold turkey, because that could be detrimental in and of itself.
Great, thanks, John. I want to come back to mental health. And Don, go ahead, please add to that.
Sorry, there's a couple of questions that popped up on the chat that I wanted to address so that everybody heard them, and that's about duration. So, most authorities are telling people to self-isolate if they've returned from travel for 14 days. This 14-day magic number is floating around a lot. And as I addressed at the beginning, it's important to understand that that 14-day number is referring to the life of a virus in a human. So the reason we say 14 days isolation when you come back from travel is that's how long it takes for us to be sure you're not going to have the disease. 14 days after infection, or when you are infected, is the minimum we think is necessary for you to stop viral shedding. 14 days has nothing to do with how long we are telling people who are at risk for coronavirus to isolate. That the time that we're asking for you to protect yourselves will be completely guided by what happens with this outbreak, and that is not relevant to the 14-day period at all. So I need to be super clear on that. And in fact, I will be completely frank with you, in most jurisdictions, we are anticipating this is going to be a minimum of a 3-month outbreak and may extend to 6. If you look at China's data, the disease transmission began in early to mid-December, and yesterday was the 2nd day that they had without cases. So you can do the math on that. That is a solid 3+ months in a country that dealt with it by complete and full lockdown of the area where people were not allowed to leave their homes. Most people around the world, most jurisdictions outside of Europe don't have that severe a lockdown. So you can easily see that we don't anticipate that we are going to somehow magically make this shorter than the outbreak was in China or we're seeing in European countries. So when you're planning, when you're thinking, and when you're looking at how long your life is going to be altered because of this outbreak, I encourage you to realistically plan for that duration of a change to the way we live our daily lives. We've been talking to everybody and telling them to prepare for the staycation summer. This is the summer that you are going to get to experience your city in the summer for the first time. If you're used to going up to the cabin, if you're used to traveling, or if you're used to leaving, I think you need to be planning to be home for the summer, because that's the earliest we see things winding down.
Thanks, Don. Janet, there were a number of questions on infusions, and I see that you answered on the text, and there's also some that came up. Can you go ahead and talk about that now, please? What people should do if they're scheduled for infusions of immunosuppressants?
Right. So first of all, as you heard, this is going to be probably altering your life for several months, 3 months, 2 months, 4 months, who knows? So I think it's important that what treatments you're on are discussed. Is there a good chance that we should just go on and get it now, or is there a better chance to wait and see? However, the epidemic might be spreading more in your local area if you wait a long time, and we don't want people to be sick. So there was a question about rituximab, and at this point in time, the Ontario Rheumatology Association has recommended for the rheumatologists, so people with rheumatoid arthritis, vasculitis, and systemic sclerosis, that they get their infusions as prescribed, because in general, if you're on your infusion and it's a repeat one, number one, it's probably been working to help you. Number two, you probably tolerate it well. And number three, you probably haven't had a lot of serious infections. So infection is really important to spread, looking at host factors, those who have a lot of infections, looking at the external factors, some of the meds you're on. But again, the biggest risk seems to be older age and people with heart and lung diseases. So if your rituximab has been helping you, you can discuss whether it should be postponed, but you can also discuss, should I just get on with my normal life and get my treatment and take my usual precautions? So what I'm answering in the text is that for early use of rituximab, the increased risk of infection is about 2 times that of the background patients on with systemic sclerosis for new use, and it's probably less than that for chronic use on repeat infusions. So that's all we can go by. So I think you have to use guessing, good clinical advice, and a bit of common sense.
Great, thank you. I see a couple of questions that popped up about ibuprofen again, which we addressed at the beginning, and so maybe some people weren't there, but I do think, if I can summarize what was said, is that there's very little evidence that we know of that things like ibuprofen would be harmful or increase risk. And at this point, people should stay with their treatments unless one of the rheumatologists wants to ask. That seemed to be an issue of about 7 or 8 people. Someone wrote something about that and speculated about it, and a health minister in one of the countries speculated more and made a decision, and then other people did, and it's since been pulled back between the American authorities, the European medical authorities. The World Health Organization has said that there's not any known risk from ibuprofen. Just to reiterate that. Questions coming up about new medicines that might come on. They're being tested as an NIH trial that started in Nebraska. What if there is a vaccine for this? Would that be counterindicated for people in immunosuppression if we do come up with a vaccine? Don, maybe you want to talk about vaccine development generally and what we might hope for, and then perhaps you or one of the others can answer the question about whether people on immunosuppressants would have any concerns with any vaccine if it's developed.
Yeah, so there's sort of 2 questions buried in there. There's one that's a little more subtle, but I want to mention it first, and then we can get specifically to the vaccine. So the subtle question is, what is our exit strategy here, right? So if we have everybody on versions of lockdown, social isolation and the like, and we're really good at preventing a surge, as we talk about, and we're really good at flattening the curve so that our healthcare systems are able to deal with the cases, but we're keeping low-level transmission going, what do we do next? Because we can't stop, or we're going to have another surge and saturate the system. So does this mean we have to keep doing this for months, years? And we don't have a great answer for that, because to get herd immunity in our communities without a vaccine, we need between 30 and 60% of the population immune. That's going to take a really long time at the current rate. So that's what a lot of us are spending most of our time thinking about, is how do we get to the next step? And obviously a vaccine or a antiviral that prevents transmission is really, really critical. The vaccines that are all being worked on are all subunit vaccines, meaning they're not the whole virus, they're pieces of the virus. No one's working on a dead virus or a live virus that's been passed and lost its ability to cause human disease. So to my knowledge, all of the current forms of virus that are being worked on will be safe for patients who have scleroderma or who are on immunosuppressive medications, because there's no infectious agent in there. The concern, of course, will be, will those vaccines work as well if your immune system isn't working well, if you're taking rituximab, if you're taking immunosuppressants? And that's absolutely a concern. And they likely will not work as well in patients who are taking immunosuppression. At that point, what you're going to be hoping for is that they work on everybody else and that herd immunity protects you, which we think is very reasonable and very likely. And that hopefully is going to be the solution exiting that.
Great, thanks, Don. We haven't touched on youth. I mean, scleroderma in youth is much less common than among other groups here. But we do have a couple of questions that keep popping up. One wants to know about risk in youth with scleroderma. Should they think about it any differently than other people with scleroderma? And another person wants to know if she should take her daughter to a state that's has less transmission right now. If she's in California, should she take her to Arizona, or should she, isolate at home? And that question's come up a few times, so I wanted to get it in front of the panel. So I don't know who would want to handle that one. Don, do you want to talk about that, or one of the rheumatologists?
Yeah, my apologies. I was answering a question and I missed what you were asking me.
Oh.
So it's Janet. I already kind of answered some of it. No matter what, if you're traveling or not, so non-essential travel should be right now avoided, because you do go to gas stations, public places to go to the facilities, eating, etc. But if you are traveling and it's necessary, you will be asked to be socially distancing, no matter what state or province you're in right now, and probably no matter what country you're in of Europe and North America and South America. So at this point in time, I think it's important to use common sense. I did mention that there's some good hand washing modules. So when you're out and come back, hand wash, don't touch your eyes or your nose, please. And someone else had asked on the Excel spreadsheet before we started about non-systemic sclerosis, and then I'll answer about kids. So if you have coupe de Sabra or morphea or linear scleroderma, your risk is probably the same as the general population, unless if you are on background immune suppression. So some of the answers we're giving apply. For kids, kids seem to be asymptomatic many times. So for our young systemic sclerosis or non-systemic sclerosis patients, you might be a vector to spread it. You don't want to give it to mom and dad or grandparents or other elderly. So please do the social isolation. It's difficult for the young adults and the children to take this as seriously because it's unprecedented and because they feel well, but you could be the vector. So please wash well, distance yourself from people, avoid elderly if you can, but please network with your group, both your peer group, but also the adults that are important in your life. And the networking can be by social distancing. So take advantage. Everyone, you know, if you're a young person, has a phone.
Great. This has been touched on a little bit before, but why don't we come back as it's coming up or has come up? What if a scleroderma person does have an infection? Should they go immediately to hospital? Unlike other people who are being asked to stay at home, what should happen if a scleroderma person does become infected with COVID-19? John?
I think it's very important that you communicate with your rheumatologist or primary care provider, because it does mean that you're at a higher risk for a more severe disease, and decisions will then have to be really made about rapid testing, hospitalization, and the next step. So if you are a high-risk patient and you are likely to have COVID, have symptoms very strongly suggestive, you have to really step up the evaluation, because you are at higher risk than somebody without these risk factors, who often can shelter in place and ride through this.
Great, thanks, John.
Just I'm going through the chats here. Sorry, I've been trying to answer the chats in real time, and there's been a number that have come about surfaces and contact with items, inanimate objects. So let me just mention a few things on this. There is a lot of information on the internet about how long the virus lives on surface X, and that can be cardboard, that can be glass, that can be clothes. You need to be very careful with all of those studies that you read, because they're all essentially using the wrong terms. They all say the virus survives to some period. Well, those studies are not measuring whether the virus survives. What all those studies do is they swab a surface, and then they look for the RNA, the sort of nucleic acids, the genetic code of the virus on that surface. That means that, yeah, there was a virus there. It could be alive, it could be dead, it could be there in minute quantities. All we know is that there's essentially what we would call the DNA signature left on that surface, and that is persisted. In no way, shape, or form does that mean that that surface is infected. We have to do completely different studies to see if the surface is still infected, and then whether you can infect yourself from that surface is an entirely different question. So those studies that are saying how long the RNA persists on a surface are the absolute longest period there could be anything there, and they're probably a gross overestimation of how infectious a surface is. We really are not particularly worried, and we haven't found a lot of evidence that there is long-term transmission from surfaces to people. If somebody coughs on something and then you put your hand on it and wipe your face like this, that's a really good way to get it. But if 3 days ago somebody coughed on a surface, you touch it, and then a little later on you go like this, that's probably not going to give you coronavirus. So again, we can back down a little bit of the concern and panic here. One of the mantras that I've been telling people, and that probably is something that we should remind people about here, is we want to keep the panic out of pandemic. And in this case, the panic is anything related to the virus being infected. If you get a package from China, it's not going to give you coronavirus. If you're, as somebody asked, if your husband is exposed to people coughing and comes home with his clothes and you want to wash his clothes, go ahead, just wash your hands afterwards, and don't take the clothes and rub them on your face. Not that I thought you were going to do that, but you get the ideas. We can be a little bit prudent, and we can be a little bit reasonable and rational with our fears here, even though it's very understandable why all of us would be very concerned, and particularly those of us that are higher risk for severe disease. We can be a little less concerned about the foreign bodies.
Don, among all of that, thanks for clarifying that we should no longer rub each other's clothes on our faces. That one is something we do here at home regularly. No, I'm just kidding. Maureen, You've been involved for quite a while, very successfully with different patient organizations and advocacy. What are patient organizations doing to support patients? What can they find on sites like Scleroderma Canada or others? And what can organizations do to support patients right now? I
Well,
imagine there's other people out there from other organizations around the world involved with these organizations.
Well, certainly. I mean, when you look to the commonality, the Scleroderma Research or the Scleroderma Foundation put out their recommendations and are following up with this event. I mean, if there's anything we can do for patients, it's inform them. This video will, or this webinar will appear as a video on all of our sites. And I think that this, if nothing else, answers more questions than 10 hours sitting on the internet, Googling and trying to figure out what you should do. The news is overwhelming, but the specific news for us here that has been answered so eloquently by Drs. Varga and Pope and Dr. Don, I just say Don, I'm sorry, I don't recall your last name at this moment. So you guys have done so much for us at this moment in time. We at these societies will continue to look for ways in which we can assist patients through this time. Converting support groups to video chats, so there's no inpatient or face-to-face meetings for the time being or for the next few months. We will provide information as soon as we have decent information that's vetted, and hopefully maybe at some future point another opportunity to speak with the experts like this. But Brett, your leadership, you and the SPIN team in putting this together so quickly, absolutely outstanding. Again, you continue to advocate for us as patients at every opportunity. So thank all of you.
Great. Well, thank you for that plug, which I promised we did not plant. I do want to mention one thing though, what we're doing, and I just put in our spingeneral@gmail.com email address. We are going to start a program, hopefully in the next 10 to 12 days, where we are going to be providing a kind of a Scleroderma clubhouse where 3 times a week you can join some other people, particularly for those of you who are isolated at home because you're not leaving. There will be some fun activities, a chance to chat with each other. If you might be interested in that, and we really hope you are, please do email us at spingeneral@gmail.com. We're developing the program very quickly. We're meeting on Monday about this, and we should have more details coming soon. But do let us know if you're interested. There'll be an opportunity to, again, this is really for people who are at home, unable to leave, are not working from home. Some people are still working and doing that, but so you're not isolated at home. There'll be groups that will be formed to help people support each other, have some fun games and activities, talk about things like how you can exercise and what you can do and things like that. So please do contact us if you might at all be interested. Yeah, the Spin General email there. I want to come back to a couple of groups that we haven't. I seen there's some on the chat. There's also some questions we got during the week. Dr. Varga, can you talk, John, about anything about people with both, I think people with organ transplants and people who have gone through stem cell transplantation already at different stages? We've had both those questions. What should they be thinking about, or what specific advice might be important for them?
Well, patients with organ transplant obviously have a significantly impaired immunity because of immunosuppressive drugs, and patients who have undergone stem cell therapy as well. So those individuals are definitely at a higher risk. So I think the issues of self-isolation to really minimize potential exposure to the virus. And again, as was mentioned earlier, even though some of the recommendations talk about self-isolation for 14 days, in this scenario, that's not what we're talking about. In this scenario, we're really talking about minimizing the possible risk of exposure for as long as there is a prevalent infection in the community. So as was mentioned, I think it does mean thinking about more long-term social distancing and self-isolation. I think, individuals who are on immunosuppressive drugs specifically for organ transplantation really need to, again, coordinate with their rheumatologist or their immunologist to determine, when there are symptoms that warrant either a telemedicine visit or possibly a visit to the doctor in person.
Yeah, Janet, sorry about that. We've had some questions come through about what the effect on the COVID-19 infection might be for lungs. You know, one person, this is Beth from South Florida, notes that she's heard doctors say that it can leave lungs, quote, honeycombed with with damage. What might one think about with scleroderma in lungs?
So that's an interesting question. First of all, my guess on what's come out of China and Italy is that the very sick COVID patients who are on the ventilators have basically this cytokine storm. They have what we would call adult respiratory distress syndrome, and again, age seems to be quite a risk. If you already have damage in your lungs and you get a serious infection in the lungs, no matter what that infection is, viral, bacterial, atypical infection, it can lead to more scarring of the lungs or sometimes wake up your quiet lung disease because all these mediators are talking to other things within the gas exchange part of your lungs. So I don't know what the case will be in someone with significant lung disease who then gets COVID and has the serious phase, which most of our patients will not go to that serious sort of third stage where their lungs are quite severely inflamed and they have to go on a respirator or a ventilator. However, I think there will be a lot of research that will later tell us. What we do know, though, anecdotally, is that people who get severe influenza virus and get it in their lungs sometimes get a superimposed bacterial infection, or they have the viral pneumonia from influenza A or B or both. And some of those patients fully recover their lungs and some don't. And certainly I think any of the experts have had scleroderma patients that have had influenza that have made a very good recovery on their lungs, even though they were very sick with their influenza virus. But again, I think the answer is we don't know. That's why the best is to try to avoid getting the infection. And the next best is, I would say, seeking medical attention if you are more short of breath and have a fever or whatever your doctors have advised. So fever and new or worsening shortness of breath are one of the case definitions here in Ontario that would lead to getting tested.
Great, thanks, Janet. I do have a general question about vaccines. Again, if a vaccine comes on the market here, but generally, should scleroderma patients be concerned about vaccines that everybody else is getting? John, do you want to address that?
Generally speaking, no. There is a concern that, again, patients on immunocompromised may not respond as rigorously and as beneficially to vaccines as others, but generally speaking, we do the same vaccination for common vaccines as we do for anyone else at that age. So not a particular concern, really.
Great, thanks, John. I have a question here about masks. This came in through the week. For people with scleroderma with lung scarring, for instance, and older people, try to get a like N95 mask or another mask to wear if they have to go to the grocery store. Don, do you want to talk about that?
Yeah, so this is actually not an issue that is a medical issue as much as it is a social issue. So first of all, we know that people should understand that the standard surgical masks are not designed for, and we have no evidence that they will protect you from coronavirus, period. They are designed to be worn by sick people who are coughing and to prevent the virus to be spread by someone who's sick and coughing. That's why they're surgical masks. The surgeons wear them to prevent contamination of the operating field from the surgeon, not to protect the surgeon in the operating room. So I think there's a lot of misconceptions around that, and all the people wearing those masks around the street are burning up that medical supply of masks, which is necessary to actually put on sick patients and keep them isolated. So I would plead with you to please stop doing that, because the individuals doing that are compromising the supply that we urgently need in the medical system. Similarly, the second type of mask, what we call the N95 mask, which are the ones that are tight fitting around the face, those are designed to protect the user from exposure. However, there is a very limited supply of those in the world, an extremely limited supply. So limited that most hospitals can no longer afford to do the fit testing for their healthcare providers to make sure that these masks function like they can. And physicians, nurses, and respiratory therapists are going in hoping that they work because we don't have enough extra masks to burn through them doing the fit testing. This shortage means that we are pleading with people to allow us to use these masks in high-risk situations where the healthcare providers who are trying to take care of these patients need to protect themselves. In Italy, 20% of healthcare providers who are looking after coronavirus patients contracted the disease. Numerous of them have died. I really plead with you to preserve this supply of N95 masks for those people out there on the front lines that are trying to keep the healthcare system up and running so that it's there when you need it. Even when we have a surplus of them worldwide, you can walk around with one of these 24/7 to try and protect yourself, but they need to be changed regularly. They need to be fit properly for them to do their job. And you buying them in the supermarket or wherever you found a supply or online and putting them on your face and assuming they're going to work is unlikely for them to do the job they're supposed to do and is depriving a healthcare worker of the safety they need to take care of ill patients. That's my public service announcement for today.
Thanks, Don. I do want to take the opportunity too to underline just one point that you said. I mean, I think we all are tremendously grateful. And I think it's important to be cognizant of this, that as we're doing the little bits we can, you know, to do our job to help other people from getting infected and so forth, that the healthcare workers are out there and are going into the hospitals and caring for people with this virus and then coming home to their own families and children too. So I think they're really the heroes out there now, and we really are very, very grateful for all of that. I think that's really important to say there. We have about 10 more minutes, but I want to get to a couple more questions that, Don, go ahead, please.
Yeah, there's been a couple of private questions sent to me about kidney disease. I just want to reiterate, kidney disease is like heart disease and like chronic lung disease. People with chronic kidney disease are at increased risk of more severe outcomes. That's very clear, extremely solid data. If you have chronic kidney disease, regardless of what therapy you're on, you need to consider yourself an at-risk group. We strongly recommend self-isolation, social distancing to the maximum that you can do. You should not be working in the healthcare setting. You should be avoiding exposure wherever possible. There is, unfortunately, however, nothing specific that we have for people with chronic kidney disease. There are no therapies. There are no specific measures. There's no specific guidance on anything that we could offer you that would change your risk except protecting yourself from exposure. I wish we had more at this point, but we don't. The same guidance goes for people with heart disease, chronic lung disease, cancer, and I think I'm missing one. I've got to be missing one. There's got to be another one. The big risk groups that you've already done. I think Janet's going to tell me what I'm missing.
Diabetes was in there and some stuff.
That's the one, diabetes. If you have any of those, consider yourself high risk, regardless of your scleroderma, regardless of your immunosuppressive medications. And those are significant enough risks that you really need to change the way you live your life.
Thanks, Don. And you know, we are talking about the kind of heroes out in our healthcare system right now. I do want to, we have a number of questions that popped through the chat and have come in through during the week about, you know, people with more limited scleroderma who are still out there working in healthcare or even working in daycare with lots of little kids running around. You know, should they be the ones out there doing this right now? I mean, we do depend on our healthcare providers, but should maybe this be a time for them to step out? I'm not sure who can comment on that. Is it advisable if you have more limited scleroderma to be one of those people that are out there, you know, caring for patients or caring for young children right now in those settings? I'm not sure who can take that question, but it would be useful to have an answer to that one.
Well, I would just say that, you know, limited or diffuse scleroderma doesn't matter. It's a question of what degree of the major risk factors you have. So age, interstitial lung disease, immunosuppressive drugs. If you are in one of those high risk categories, then I think the self-isolation and the protection, self-protection measures we talked about are very applicable. If you have the kind of scleroderma that's been very stable, not on immunosuppressive medicines, not significant lung involvement, you're in a lower risk score or lower risk group, regardless of what particular label we give your scleroderma. So it's really based on the individual disease activity, treatment, and organ involvement.
Great, thanks, John. You know, what we've talked throughout this about ways to keep oneself safe and prevention. Those largely have come down to, you know, distancing and isolation and so forth. I think we always want to eat well, whether it's generally, but we do have we had a number of questions come through about, you know, we already talked about Dr. Sheppard addressed vitamins and this kind of thing, and we don't have evidence for those. But we've had some other ones, you know, using it. Is there any secret out there that someone can do beyond distancing? And we have a number of questions of different. Is there anything we can do, or does this secret or that secret potentially work? Other than distancing, and Don, what is there anything else they should know about, or is that the main thing, Don?
Yeah, of course, the answer is no. There's no secret, or if it was, everybody would know about it and we'd have knocked the outbreak on its heels. I'm sorry, that's just the truth. We are of a generation where we all think that if we search hard enough on the internet, we will find the secret answer that nobody else has, and that it's just out there because everything's on the internet. But sadly, that's not the case. There is one thing we haven't mentioned. We sort of danced around it a little bit and implied it, but I want to state it outright. For you to get any infection with a respiratory virus means you have to breathe it in or stick it in your nose, your eyes, or some other mucous membrane. One of the best ways to reduce the chances of that is to be in an area where there is a lot of air, fresh air coming in. And if you think about it, there are many ways that this is relevant. So when you're out walking on the street, there are infinite number of air exchanges because you're surrounded by a huge amount of fresh air that hopefully is moving and you're moving. So you're constantly being exposed to fresh air, and the amount of virus you might be exposed to is being diluted. The same thing applies though when you're in a vehicle, on a bus, when you're in your home, when you're around anybody, anywhere you can increase the amount of air circulation, you're going to decrease the amount of virus hanging out in the air waiting to infect someone. So if you have to take the bus to work because you take the bus, roll down the window if it rolls down. If you are sharing a car with somebody, you can have the windows open if they're not someone you live with on a daily basis. You can open the windows in your house if you don't live in Montreal like I do and you don't want to freeze to death, and you live in a much more enjoyable climate where you can open a window without risking hypothermia. These are very simple things, but get air circulation. They say the solution to pollution is dilution. Well, in this case, the solution to the virus can be dilution.
Great, thanks, Don. Well, again, one last question, then we'll have closing comments from the panelists. And again, thanks to all of you. You've been tremendously generous with your time in participating in this. Is there risk that if someone's had a scleroderma that's they haven't had any flare-ups or episodes, it's been managed quite well, that getting the virus could activate their scleroderma? John?
I don't think there's any reason to think that that would be the case. Haven't heard of any cases like that, haven't seen reports. There's really no rational reason that I can think of that would be a concern.
Great, thank you. So I do want to make a couple of quick points before we close, that we've all been referring to recommendations from the Scleroderma Foundation. The reason we're referring to those recommendations is because the Scleroderma Foundation put together a panel of experts, including Dr. Varga, and the way we make trustworthy recommendations is not that each of us says, in any case, whether it be recommendations on breast cancer screening or what drugs to take for a condition, we tend to put together panels so that we can vet what we say through each other of the top experts, and that's what the Scleroderma Foundation has done. If you get different experts, they might tell you to do different things. And I think what the Scleroderma Foundation panel does, it brought together people, and they're not the only people who know about this. They are quite expert, and a wonderful panel. But they did come together, they worked on this together, and they put together a statement of what all agreed were sensible recommendations. So that's on the Scleroderma Foundation website, which I believe is scleroderma.org. And maybe Lydia or Mariette, if you would post the Scleroderma Foundation website here, that would be great for everybody in the chat. I also want to point out that a number of other organizations around the world are endorsing these recommendations. And basically that means that they're saying that, listen, there's no need to do different panels. All that we have a great panel of experts. Take a look at these recommendations. I know that Scleroderma Canada has done that. Scleroderma Society of Ontario, Scleroderma Quebec is translating those in French. And thanks to the Scleroderma Foundation, Robert Riggs, for his leadership with this and in allowing people to translate these and post these. I know New Zealand has endorsed these, among other people. So, you know, look at your own patient organization websites. The Scleroderma organization has some good guidance. Before we close, I do want to, we'll take comments from the panelists and we'll do a final wrap up. So just a brief comment, a take home message for everybody. We'll go through the same order as we started, but Maureen, do you have a final comment for people?
Use devices like this to reach out when you're feeling lonely, when you're feeling scared, when you're anxious. Friends and family will be there for you. It doesn't have to be face-to-face. Maybe it's time for a virtual cup of coffee. Have a great time exploring new ways to communicate with each other, and follow all of our websites for anything else we can provide to you. Thank you.
Brett, you're off again.
Thanks, Maureen, and thanks for all you do for the Scleroderma community over the years. You've been a great leader in this community and have many tangible results for your efforts out there. Thank you. Dr. Sheppard, and thanks to you for being here. I know you have invitations for about 20 of these today, and I know our patients, and speaking on behalf of everybody, are really grateful for you taking your time out of everything you're doing in the middle of this and all the responsibilities you have. So thanks, Don.
Yeah, and let me just leave people with this final thought. Remember, your job right now is to spread information and not the virus.
Thanks, Don. Janet?
So I'd love to thank the panel as well, and especially Brett with his background people for putting this together on a short notice. So I think don't let hysteria rule. Many of us will actually develop COVID-19 infection, of whom the majority will be asymptomatic or mildly symptomatic, and the majority of us will come out of this like a regular cold. What is important is you don't want to get it and you don't want to spread it. I think you have to look at your mental health and make sure you reach out to people, as Maureen said. Please try to be normal in your relationships, because everything else is topsy-turvy. The stress of health, finances, your medications, do you take them, don't you? Do you get your healthcare visit or don't you? Is virtual good enough? There's a lot of stressors, so please go back to first principles. Keep yourself safe like any other infection, washing frequently, go out, get your groceries early in the morning. More stores are doing that for people who are immune suppressed and elderly. I think as well, get someone else to get your groceries if you're scared or at high risk. Please try to exercise and eat well and keep up your contacts with people virtually. Go for a walk is fine, you heard that. And just again, if you are really sick, you're more short of breath and or a high fever, you seek medical attention in the emergency rooms or the COVID testing sites. Don't go to those places if you're not really sick. Don't wait till you're super duper sick, but if you just feel you have a minor cold, it is not time to be seen. Just wait a day or two, see how it goes. If you feel really sick or you're in doubt, get seen, but going to these places puts you at risk for infection. I'll stop there. You're muted, Brett.
I know. I think I only have about an 85-minute thread, and I've lost my thread. So sorry. I'll keep reminding me. Janet, thanks for all you do for the Scleroderma community and all your efforts here in Canada, internationally, and thanks for being here today. John?
Yes, I just want to thank Brett and everyone else for being on this very informative call. I want to reiterate that while many of you are maybe at a higher risk because of all the reasons that we discussed, there's really no reason to panic. Many doctors, scientists are working day and night to better understand the disease, its management, its prevention. Many things are happening. And so working with the system, working with your rheumatologist, we'll all get through this. And, you know, you have to hang in there, get through it. Self-isolation is, I think, very important to minimize the risk of infection. and realizing that this is not going to be a 2-week or 4-week thing, we have to think a little bit more long range to get through this until we see a light at the end of the tunnel. Thank you.
Thanks to you, John, for being here. Thanks for your advice. Thanks for your leadership with all this. I want to say that before we sign off, I'm posting right now on the chat, SPIN contacts on Twitter, on Facebook, and our website. Our role, our mission is education, support, managing disease. So we are committed to being a conduit for good information in this. I want to emphasize what others have said. Your source for good information. This, one characteristic of the scleroderma community as a rare disease is you all, as members of this community, have done a wonderful job having structures and organizations, much more than other groups like this. And please depend on them right now. Go to your patient organizations, whether it's the Scleroderma Foundation, the states, the Canadian provincial organizations, Scleroderma Canada, FESCA, and your European organizations. Depend on them for the information right now. They have good information. They're being advised by the top experts here. Those are your places to go for this. If you follow us on SPIN, and again, I posted those about a minute ago, about a minute and 8 or 9 posts ago, we will get you the information as it comes out. We will let you know when updates are happening on the scleroderma recommendations, for instance. We will be posting information on a number of things, staying connected, mental health, what you can do to be active at home right now. These are coming up. And as I said, we are going to be launching a program to help connect people who are at home to each other with scleroderma. Hopefully we'll get that off the ground in the next 10 to 12 days. We're moving as fast as we can humanly possibly pedal at this. And to do that, this recording is going to be available. It's going to take probably about 60 minutes to get it downloaded and converted. Once this recording that's done, it will be posted. If you look at the invitation to this forum, there's a number of places between YouTube and websites and Twitter and Facebook feeds where you can find this video. The different organizations should touch base with us. We will give you a link to the direct file. It's too big to send by emails. If you link to the file, you can download it and post it on all of your websites so people can find it there. We will do our best. There's been a lot of information going back and forth on chats. Thanks to all people on the panel who've been answering those and people have submitted the questions. We'll do our best to get some of these frequently asked questions page out as soon as we can to everybody else. Is there any important information I'm forgetting to get to people right now? Okay. And then finally, again, tremendous thanks to our panelists. Nobody could do this without you, for all you're doing for caring for patients and our communities and for being here today. Thank you to our sponsoring partners, Scleroderma Canada, the Scleroderma Society of Ontario, the Scleroderma Foundation, and the Scleroderma Research Foundation. A ton of thanks to all of you. And just a massive thanks to our SPIN team, the young people on this. The whole team will put this together. This came together in just a couple of days. Angelica Barreau, who's puts together the infographics and information, Lydia Tao, who's done massive amounts to organize this, and Marie-Ève Carrier, who's been with us for now 7 or 8 years and make sure all of this runs and says, do this now, don't do that. And we all listen to her and make things like this come off as scheduled. So thanks to Marie-Ève, we can't thank you enough. So everybody, do your best out there. And as John said, we'll all get through this. Thanks for being here today, and we look forward to being in touch with you more in the future. So have a wonderful rest of the day, everybody, wherever you are. Thank you. Bye.